Today we will discuss enteric fever. The enteric fever is a clinical syndrome which consists of gastrointestinal symptom plus constitutional symptom. The constitutional symptom include fever, headache and malaise. The enteric fever is caused by two group of organism. The first one is a Salmonella typhi which cause a typhoid fever, and the second one is a Salmonella paratyphi, predominantly A, S, B and C serotype, causing paratyphoid fever. Both of these organisms, Salmonella typhi and the paratyphi, are the gram-negative bacilli. So like every gram-negative bacilli, they consist of three type of antigen: O antigen, H antigen and V antigen. The O antigen is a cell wall lipopolysaccharide antigen, the H antigen is a flagellar antigen, and the V antigen is a capsular or the lipopolysaccharide virulence antigen, and it is located in cell capsule. Although the enteric fever is caused by both typhi and the paratyphi bacteria, but predominantly it is caused by a Salmonella typhi. So the enteric fever is also called as a typhoid fever. So now let's discuss the pathogenesis, clinical feature, diagnosis and the management of typhoid or the enteric fever. The causative organism of a typhoid fever, salmonella, is spread through a fecal-oral route. Normally about 10 exponent 5 to the 10 exponent 6 organisms are required to cause a clinical feature of a typhoid fever. When we ingest this amount of organism, it will reaches a small intestine and will invade the mucosal barrier of a small intestine, and it will replicate in the Peyer's patches, mesenteric lymph node and spleen, leading to the hypertrophy and the hyperplasia of the Peyer's patches, the splenomegaly and the enlarged mesenteric lymph node. After replicating in these three organs, the salmonella spread in blood causing bacteremia. This bacteremia cause a widespread clinical feature. During prodromal stage, the patient will develop fever. The fever of the typhoid will rise in a step ladder pattern. By the step ladder, we mean that initially there will be a low grade fever, and this fever will increase with time without touching the baseline. Along with this, the patient will develop malaise, headache, cough, sore throat, abdominal pain, constipation, and diarrhea. The patient develops constipation because there is a hyperplasia of the Peyer's patches. Due to this hypertrophy and hyperplasia of Peyer's patches, the patient can develop a constipation. But sometimes the patient can develop diarrhea. The diarrhea is produced because the salmonella irritate the gastric mucosa. When it irritates the intestinal mucosa, it can cause diarrhea. The diarrhea of a typhoid is described as a pea soup diarrhea. After prodromal stage, this step ladder fever will change into a plateau fever, mean that the patient will develop a high grade fever, usually greater than 104 degree Fahrenheit, along with a toxic look. And during this stage, the patient will also develop a physical finding such as splenomegaly, abdominal distension, tenderness, relative bradycardia. What is meant by this relative bradycardia? The relative bradycardia means that during fever the patient develop a tachycardia, but in typhoid there is a bradycardia, and it is a classical sign of a typhoid fever. Other than this, the patient also develop a rose spot. The rose spot are 2 to 3 mm papule, usually develop on a trunk during the second week of a typhoid, and it fades on pressure. It was all about the sign and symptom in typhoid fever. Now let's discuss the lab finding. The diagnosis of the typhoid fever is usually made on blood culture. The blood culture is usually positive during the first 2 weeks in 80% of a patient, but the blood culture take time. So for the rapid diagnosis, we perform a CBC. The CBC will show leukopenia, mean there will be a decreased WBC count along with an eosinophilia. Other than this, the patient will also have a transaminitis. Other than these, we can also perform bone marrow culture and a stool culture. The bone marrow culture is the most specific test for the diagnosis of a typhoid fever, but it is usually not performed because it is expensive and a complicated procedure. And the last one, the stool culture, is usually not performed. Some people perform it, but it lacks sensitivity because it is positive during the first week, and the patient develop a symptom of a typhoid fever after 1 week. So during the symptomatic stage, the stool culture will be negative. Now come toward the treatment of a typhoid fever. The choice of antibiotic depend on culture and sensitivity, but the culture and the sensitivity take time. So for during this time, we can treat a patient empirically. Empirically, previously we were using cephalosporin, then the typhoid bacteria became resistant to it. After that, we were using a ciprofloxacin, but now the bacteria also develop resistance to ciprofloxacin. These days, we use two class of drugs to which the bacteria are sensitive. The first one is a ceftriaxone. We give a 2 gram of a ceftriaxone IV OD for 14 days, and the second one is an azithromycin. The azithromycin is a drug of choice for typhoid fever these days, and we give azithromycin 1 gram state, and after that we give a 500 mg OD for 5 to 7 days. Most of the time the patient show response to the ceftriaxone and the azithromycin, but if the patient is not responding, we should wait for a culture and sensitivity, and we give a antibiotic based on a culture and sensitivity. Recently, in a specific region of the world such as Iraq, India and Pakistan, there are certain strain of a salmonella typhi which are resistant to even ceftriaxone and azithromycin. So in these patients we can use meropenem prophylactically. It was all about the treatment of a typhoid fever. The typhoid fever show a good response to treatment. Usually it is not very fatal. Only 2% of a case became fatal and patient can die from a typhoid fever. Sometimes the patient can develop complications such as the intestinal perforation, which occur in about 1 to 3% cases. Second one is the intestinal hemorrhage, which occur in about 1 to 10%. Remember that whenever a patient develop tachycardia with fever, the classical sign of typhoid fever is fever with relative bradycardia. So whenever if a patient develop a tachycardia, we can suspect an intestinal hemorrhage. The third one is a toxic encephalopathy. The fourth one is meningitis, and other than this, it can also cause osteomyelitis, septic arthritis, mean that it can cause a wide variety of complication. But a rapid treatment can prevent the mortality and complication. So it was all about the typhoid fever. If there is still any question, you guys can ask, and stay tuned for more update.